Hi Sheila, I have been meaning to ask you if you are still having that burning pain in the ball of your foot.
Thanks for asking, Ted. As I told you a couple of weeks ago, I was having pain, tingling and burning just behind my third and fourth toes. It would not be too bad when I was barefoot or even in sneakers, but once I put on a dress shoe, I started to get the pain. Most times the pain would start in the ball of the foot and then the pain would travel into my toes. On occasion there would be numbness and tingling into the toes. They would feel like the toes had fallen asleep. Whenever I would wear my dress heels, it seems I would be walking along, all of a sudden the pain got so severe that I would have to stop. I would remove my shoe and rub the area. Within a couple of minutes the pain would diminish, only to return once I started to walk again.
So what did you do about it?
I went to see a podiatrist. The doctor examined my foot, checked for various conditions that could cause pain in the ball of the foot. Eventually he made a diagnosis of Morton's neuroma.
What is Morton's neuroma?
As the doctor explained it, a neuroma is a pinched nerve that occurs between the metatarsal bones, which are the bones just behind the toes. A tight-fitting shoe or a shoe with a high heel will squeeze the metatarsal bones together and put pressure on the nerve. This will then create the pain.
So how is Morton's neuroma treated?
The doctor mentioned a few different options. In simple cases, many times an oral anti-inflammatory may alleviate the pain. In more severe cases, oral medication will tend to have minimal effect. In these cases, injections can be very beneficial. The two types of injections are either cortisone injections, which reduce the swelling of the nerve and thus the pain. The other injection is known as denatured alcohol. This is a series of shots which attempt to sclerose or deaden the nerve, so that the pain transmission is inhibited. The doctor told me he has had a lot of success with this type of treatment with an over 80% success rate. It is so successful in fact that the doctor rarely has to surgically remove the nerve in the vast majority of his patients.
What treatment option did you choose?
I went with the denatured alcohol injections. Even though the neuroma occurs on the bottom of the foot, the doctor gave me the shots through the top of the foot, which as you can imagine are far less painful. I was told beforehand that there could be as many as 7 injections over a 7-week period.
That sounds like a lot of shots.
You are correct, but in my way of thinking, it sure beat surgery. As it turned out, I only needed 5 injections. The neuroma pain disappeared and I was done.
Can the neuroma come back, and is there other conditions that can mimic a neuroma?
The doctor said that sometimes the pain can return, and if it has been over 6 months, he could redo the injections again. In most cases it would not require as many shots. He suggested the types of shoes I should avoid. Prior to making the diagnosis of neuroma, the doctor explained to me that other conditions that could be mistaken for a neuroma include capsulitis and intermetatarsal bursitis.